It's natural for many of us to take our independence for granted until we face a health crisis that challenges that independence. Stroke, accidents, or surgeries can lead us all to face physical and mental obstacles. And that's when we turn to the professionals for help. I'm Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. I'm joined by my co-host and co-author, Wendy Benson, and occupational therapist, Tara Perry. Terry is from the University of Southern California, and she has some great insights to share with us as we or our loved ones face new challenges with our independence. Wendy, does this sound familiar to you?
Well, you both know that I'm an occupational therapist by background. This is a subject that is near and dear to my heart. Tara, we are so thrilled to have you with us here today.
Thank you, guys. It's nice to join you. It's lovely. It's been a great experience working with you.
Great. Can you tell us a little bit about how you chose the field of occupational therapy?
The profession of OT was something I didn't even really know about till I needed an occupational therapist. And that tends to be a really common experience for my clients, my patients, when I first meet them. About 15 years ago, I had an accident, a trauma accident that transformed my way of thinking and put me down a rehabilitation course myself. Over a period of time working with therapies. And I got to learn about the profession and found it to be a really unique career path that allows you to work in really diverse settings. I'm fortunate enough to be able to work with patients who are as early in their critical care experience as in an ICU, or waking up from surgery on a medical surgery floor, or working on rehabilitation goals in an inpatient rehab hospital, or outpatient therapy. And oftentimes I find the most rewarding is working with people in their own homes. So seeing them in that last transition into their normal environment. So OTs, we get to do this really diverse practice and see people in a lot of different settings.
Yeah, it's really great. And there's just so many different ways that we can make an impact on the lives of our clients and their families. So I know that there are some times when we start working with a client as a therapist, and there might be some myths or misconceptions. People might have some, questions about what therapy is. What are some things that you've addressed with some of your clients?
The myths, let's see. The biggest myth I kind of see is that our clients, our patients will say things like, oh, the doctor has the answer, or they think the therapist has one way of offering a solution to them. And that's really not true. The doctors don't have all the answers sometimes. Sometimes it's the care team bringing a different perspective to the person to help them see the variety of answers that can solve their problem. There's not just one way to do something. And some of the concerns I see patients coming in with is a shutdown attitude at first that says, I can't. They're starting off from a point of I can't, or even starting off from a point of I know, which can be a dangerous way of thinking, risky in shutting down the process of learning and rehabilitating before it even really starts with I can't, or I know everything. I don't need any more information or suggestions.
It's really like a psychology. I'm sure you took a ton of psychology courses, because it's like you got to break that all down before you can rebuild the new thought process.
The curriculum I participated in about 10 years ago at the University of Southern California really focused a third of our learning in mental health, where we really help to work with understanding in individuals' lifespan development of psychological processes and human emotion, how it relates to illness and injury and adjustment. So yeah, there's a lot of mental health involved in an OT session. It's not just as simple as learning to dress yourself or take a bath.
Right.
We're also looking at the emotional development adjustment of the person.
Yeah.
And, I think so much of what we do as healthcare clinicians is focus on empowering our patients. Like you said, Tara, it's not like one person has all the answers, but how do we help people regain as much independence as possible, right? And so what are some ways that you've helped people realize that they can become independent, but maybe in a different way?
I've helped patients gain confidence by rebuilding independence. We start by looking at the foundation that the person's working with, such as, what are their basic skills? What an analysis of their current strengths, supports, environment, assets, resources, really understanding what the person has going for them. And then from there, that breakdown of looking at where their current skill is, we're analyzing their strength, we're analyzing their balance, their memory, their vision, where they're at functionally with the ability to do the basics in life, like just get out of bed, walk a short distance in their home, to dress themselves, to bathe themselves, to clean their house. More complex tasks are involved too in basic life. Can you drive? Can you pick up a baby? Can you perform your work duties? Can you cook for yourself? Can you play? Can you participate in the leisure activities that are really meaningful to that person? So we look at basic skills, we analyze as OTs. We're taught to analyze the strengths and weaknesses, and then really analyze the barriers to that person getting to their goals. And then we educate, we set a game plan, and we get busy. We get busy in our interventions and our sessions to get that person to their game plan of independence, or what independence means for them, with the current realistic expectation of the supports, abilities, strengths.
Mm-hmm. And that's so important when it's tied to their goals and what they want to accomplish and what's important to them in their lives. So a big part of working with individuals in healthcare is not only working with the patients themselves, but their family members. And when we think about the care team, the family members or someone's community are often a big part of that. How do you engage, and how is it successful for you when you involve the family members or the patient's chosen family members? Because sometimes I like to say my neighbors are my family members, depending on from a geographical perspective. Sometimes our family is our chosen family.
Absolutely. The supports someone has around them, it's always can be a variety of people, from a friend, a neighbor, a daughter, a parent, even sometimes just, assigned clinical caregivers are who that person has to rely on. My encouragement in getting family into the sessions, invested with the person, is, I do ask of the family, or whoever it is that person's support, to be present, meaning, have an open mind, be there with the patient, be kind to them, be patient with them, try not to stress them out. There's enough going on for that person, that individual, to process that. If there's anything that family or friend can do for that person to lessen stress, that is helpful to the situation. And to not be afraid to continue to bond with the person, meaning, don't be afraid to talk to them or hold their hand or ask them how they're feeling. Don't ignore the elephant in the room, meaning the illness or the injury. But also know that in bonding and keeping that human connection with the person, that helps lessen their stress. That helps make them feel like the person that they are, or those relationships. So I really try to bring the family or friend into my sessions as much as possible, if they want to participate, if they want to learn, if they want to watch, or even sometimes acknowledging that friend or family member might need a break. So in sessions, asking, do you want to be present? Go have some lunch, take a break, take a walk, take a breather yourself. So there's a lot there.
Yeah. No, I mean, it's great advice from all sides. And I think oftentimes, as healthcare professionals, we can work with somebody who has had significant changes in their function, right? Whether it's been through a stroke, a car accident, a debilitating illness. And I think that knowing that not only have things changed in the way that somebody may be able to accomplish something, but that we also have to, if we're the caregivers, if we're the support system, that we do have to take time for ourselves. Absolutely. So what advice do you have for patients to become more confident, to gain more independence? What advice do you have as an occupational therapist, as a mom, in all the different roles that you have in your life, Tara? What advice do you have?
That we not forget to address the mental blocks. Acknowledging if someone, if a patient and a client is feeling anxious or anger, fear, embarrassment, frustration, as healthcare providers, I think best healthcare providers acknowledge that the person is really going through something. They're going through something that might just be so difficult. Acknowledging that a situation sucks. It's a very human way of relating to someone.
Mm-hmm.
Give them a moment to express themselves, to acknowledge those feelings, and allowing people to have that room, I think, helps build the trust factor, which is really important in a therapeutic relationship, that we can continue to get someone to their goals, is allowing them to be honest and trust you. So acknowledging the mental health piece is really, really large. We keep circling back to that in this conversation. I didn't think we were going to go there, but it is very important to build confidence, is that we acknowledge that the person is really maybe going through something emotionally that needs acknowledgement.
Yeah. When I was in the hospital, we would send our patients down to occupational therapy, and as a nurse on the floor, I never realized what happened down there when they would go to therapy. Since starting 2x2 Health and going with patients to these appointments, it has been eye-opening. I had no idea the bandwidth that occupational therapists, they go over everything, like how to, do multiple steps of something. You have 3 things to do today, how to coordinate that in executive functioning. And I have been blown away. And I really think that this discipline is going to grow even more in these next couple of years, because I think people are starting to realize the importance of it. It's just so important from a mental aspect, but also from a physical aspect too. So amazing. Well, Tara, thank you so much for sharing your insights. We've learned so much. Of course, you can find it all of our episodes on the Confident Patient in the New World on our YouTube channel and our website at 2x2health.com.
Thank you so much for joining us today, Tara.
Thank you for having me. It's again, a pleasure working with you.
Thank you. And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.
Thank you.